Hey, Ashley, allthingshistory.com. So in front of you see one of our oral surgery kits. And before I got to residency, it was a little rusty on the names of my instruments and sort of what to use. So I asked Dr. Partridge to come and give me a hand, and here he is. So without further ado.
Okay, thank you, Dr. Mark. We also have two sets. This is basically what we call our complex set for complex extractions. And this has what I call 90% of all the instruments you need. You can't include 100% because that would take 3 or 4 trays full. So you set up basically 90% of the instruments you always need, and then if you need an extra instrument such as a rongeurs, or maybe you need a 23 forceps or a 65 for bicuspid, you can add that as you need it. But your basic complex set should have about 95% of the instruments you use. If you're doing a lot of simple like number 8s and 7s and things like that, you may have a much simpler kit with only half these sets. You probably won't need the osteotome and the mallet and things, so that's up to you. But again, it has about 90% of the instruments that you need. And we'll just go in some sort of order here. Of course, the first one you always have is your sterilized syringe for anesthesia.
One of the things that we have here are not the auto aspirate, but they actually engage, so you can aspirate. And there's a few different. Have you had any experience with the auto ones?
No, I haven't used those yet.
Right, next
but
one.
There's always something new. Always something new. Yeah, this is a tongue retractor. I don't really use this that much. Usually our oral surgeons have the patients sedated. It's a little bit bulky for the patients, but this is a Veeder tongue retractor. Works quite well, but it's a little tough on patients that are still awake. This is a pickup, so it looks a lot like a hemostat, but if you look real carefully at the nibs, only the top of the nibs engage and the rest of it doesn't engage, so it's a pretty convenient tooth for picking up tooth or tooth fragments. Scapella handle. Usually we use a Bard Parker number 15 blade most of the time, but you can use other blades. This is our Copeland suction, which I use for surgical suction. It has a narrow tip, which is good for getting down inside of tooth sockets and stuff. It's a little slow if you're really irrigating out the mouth with large amounts of fluid, and it backs up, so in that case we'll go switch over to the Yonkers, switch to the acrylic one, and that'll suck up about 4 or 5 times faster than the surgical pickup. It'd be nice if you have both those at the same time. When you're irrigating out, if your field is flooded, you have to wait till it's dry to really do irrigation. What I'll do is intermittent irrigation. I'll 10 cc's and I'll suction it all out, and once it's dry, then you irrigate it some more, 10 cc's in and out like that.
Since you're talking about irrigation, this is what we've been using too.
We use a 30 cc syringe, and you need lots of irrigation. Always use tons of irrigation.
As compared to
this is good
guys.
this is actually for patient treatment for irrigating dry sockets and other things like that. But this is one we use, and this one is absolute is sterilized. I always want to come up with an idea of having a camel pack with unlimited irrigation. So if somebody wants to go ahead and make one of those and patent it, maybe make a few dollars on the side there. We have a number of hemostats. We have the straight hemostat, just depends on which area you're working at, pretty well self-explanatory. And then the curved hemostat, which has a little tip for getting into tighter areas. Now the hemostat has a straight serrated nib. If you probably cannot see that on the camera, it's just serrated in one direction there. Now we have the needle holders that look pretty close to that, but if you look at the needle holders, it's a crosshatch pattern on there, so it grabs the needle at any angle that you want. So that's the difference between the nibs on a hemostat and needle holder besides the basic design, is that the hemostat has just simple serrations and the needle holder is crosshatch. The Dean scissors, which is very handy for cutting off, of course, sutures, but it's also for small pieces of tissue and tags and things like that. And it's got a slight angle on it, so you can reach down into areas that are hard to access. Now the Russians are used for retracting teeth or tooth fragments in there, and again, it just hits right at the nibs there, so a little bit like the tooth pickup thing there. It's pretty good for getting little tight areas and picking out little tooth fragments. And of course the cotton pliers, which you can use for moving cotton and other medicaments around on your table. We'll go through some of our, we'll go for the Molt mouth prop. Now this is pretty convenient because you can open it up pretty wide and you can adjust it for the patient. The only problem with the mouth Molt bar, it's the way the design is, as you release it, it actually opens it wide. So if you want to release it, it's almost like a two-fingered thing. It's a little bit awkward to use, but it's a little better in some ways than the standard mouth prop because the area in between here is a little bit open. Our forceps, generally we'll start out with the smallest, our elevators, our 301, and once you work that in between the tooth and get a little luxation, then you get a little bigger area, you can use the 34 elevator to expand that and get a little more luxation with it.
I got to mention this one, sir.
Okay, that's 77. I always start out with this. This is the one that our Canadian friends kind of introduced us to it, but it became very popular with all of our residents and the staff. It's got a little curved end on it, and for certain areas, upper maxillary thirds and stuff. It's really a very convenient instrument. It has a lot of dexterity to it. You can really use that quite a bit. Cogswell A. Once I get a big area in there that I can get the Cogswell A. The other thing I use the Cogswell A for is I use it for sectioning teeth. I'll make a little groove in the tooth, and you can slide it on the narrow one, and then when you turn it sideways 90 degrees, it's really wide, so you can really expand it quite a bit. So that's good for fracturing off teeth segments there. And the Cogswell B has a little bend in it. That's the way I remember it. It's got a little point on it, so sometimes you have a little fragment you can't quite get out. I'll just drill a little hole in the fragment, put it right in there, and you can lever that off of the alveolar crest and remove fragments that way. Also, you can sometimes, if you want to start the luxation, and if you can't get any other elevator, you get that little tiny tip in there, and that works out very conveniently. Miller's left and right, they're curved in opposite directions, as you can see. And those are good for getting out root fragments sometimes on mandibular teeth, but also sometimes on third molars, maxillary third molars, you really don't deliver it occlusally, you kind of bring it out to the buccal side, and so sometimes you can slip that in there and pop it out to the buccal side rather than trying to deliver the tooth occlusally. So it's another little convenient design there to get into tight areas. Now these are Acquire East and West instruments, as you can see. Now I really like these for mandibular broken off root tips, because you can get through the opposite socket. So you have a mesial root tip that's still retained, you can put it through the distal socket, elevate out the mesial, or vice versa, go through the mesial empty socket and elevate the distal root tip. So those are very handy for root tips. Guess you can edit that.
We'll keep going.
Okay, all right. Had a little interruption there. These are root tip picks. The name is self-explanatory. When you have small root tips, they're down inside of the socket, and you see they're curved on opposite directions. So you have kind of a right and a left one there. So those are very useful for some sort of retained root tips. The Sullivan retractor is the one I use quite a bit. I really like this for retracting gingival tissue to get out of the way. It doesn't stretch the patient's mouth out quite so much. You can get back in there. The only problem is you have to watch real carefully when you're using your burr and other instruments, because it can rub against the burr. So for that reason, a lot of people use the Minnesota. It's a little bigger, and you can see it's a wider area. It retracts quite a bit of tissue there, and it's a little safer with the burr there. But it does stretch the patient's mouth out. It's a little more uncomfortable, and sometimes it's a little tighter area. Just whatever works best in your hands. Bone file. Anytime I use the hand piece, I always use a bone file, make sure there are no sharp edges, or anytime you have something periodontally involved ridge where it's really irregular edges on there, I always, actually I'll put the flap over, feel my finger. If I feel any sharp edges, I use the bone file to trim that down. This is a Woodson, which I use quite a bit to initiate my flap after I make my incisions with the scalpel. I just find this little sharp edge down here, and these is a little better to initiate the flap. It's kind of weak, so once I get the flap exposed, then I'll exploit that with the number 9 Molt, which is a little stronger instrument. The other thing I use that number 9 Molt, the pointed tip sometimes, is to use it almost like an elevator to get in between two teeth, and once you initiate it, again, you can switch over to your bigger elevators, but that's pretty good for getting the little tight areas in between teeth. This is one of my favorite little instruments. It's the number 15 scaler. I use this for a number of things. Once you lay a flap, you have a tooth that's partially exposed or partially impacted. There's going to be a lot of periodontal ligament or follicular material around it. You can't really see it real well. So I like to curette that off with it, and that the material will also jam up your burr, so that's good for cleaning off that tooth. The other thing I use that for is sometimes real tiny little root tips. You can get down in there and pick out a little root tip pick with it. And I also say it's my 6th finger. I've been doing dentistry so long, when I scratch get something, I can find it. I know by touch whether it's alveolar bone, dentin, or enamel. So sometimes I'm going around there trying to delineate the tooth. I can just kind of feel stuff down there, and by the scratching I can tell what it is. This is your double-ended curette. Again, kind of self-explanatory. When I curette out leftover granulation tissue or follicular material, and it's a left and a right-handed, depending on which end of the shaft you use there. Very useful instrument. And this is a mallet and osteotome. Some people call it a hammer and a chisel. It's a little healthier than your regular periotome, as you can see. And on the mallet, you'll notice it has a nylon tip on the end of it, a little cushioning area on there. And that's in there. It acts like a shock absorber a little bit. If you have metal against metal, it's really jarring on the patient. The other thing that acts kind of like a skid protection, so that when you're hammering, it doesn't slide off and hit the patient in the jaw. These will scratch and wear out in time. So what I would recommend as soon as you get this instrument, that you look at the insert and you order a couple extra sets of the nylons and keep those around for quite a while, because the mallet itself will probably never wear out in your entire career, but these little nylon things can wear out occasionally. And then our standard forceps we put in there are your 150, which is pretty universal for most teeth, uppers, and even a few lower ones. The other one you can use is the 151. Again, it's got a slight angle on it, so it's good for lower teeth. And then the one I like quite a bit is the 151S. It looks like a 151, except it's a little smaller. It's a PO instrument, and the reason I use that is because these nibs are a lot smaller, and especially for maxillary thirds, it's kind of hard to get the 150 all the way back in there sometimes. This will slip in there, and if you got a big coronary process or a big buccinator muscle in that thing, it will get into tight areas a lot easier. So those are usually the only standard forceps we have. Again, when you're setting up and planning your tooth, you want to planning your extraction, you want to look for other tooth-specific forceps like the 23 or maybe the 65 for bicuspid. And again, some additional things you may add to it are the rongeurs if you're going to do some bone trimming. Of course, the syringe is always enclosed, and we always have our
Extra suction tips.
Extra suction tips, extra needles, and irrigation cups. We always use saline. We don't use sterile water because you want it to be physiologically compatible with the tissues because you have it exposed. So I would not use sterile water anytime you're laying a flat. Make sure you always use physiological saline to irrigate it out. And we also have some of the other things that are included. We have a sterilized aluminum for covering the handles, lots of extra cotton, all those other little things that you need to do oral surgery. So that's our complex set. Again, the basic set, a simple set you can make just based on what things you like to use. But this will cover 90% of all the instruments you need. And again, just add a couple, 2 or 3 instruments at the beginning of the procedure for whatever specific tooth or procedure you're doing. And that usually handles it. The only thing we haven't discussed is sutures, but I think we discussed that in another lecture.
We did, yeah, very well too.
Okay.
All right, sir, thanks for your time. And we'll hopefully get you in action using these in the next few weeks. Cheers.